Welcome. This is To The Root Podcast, brought to you by We Grow Hair Indie and Transitions Indie, where we get to the root of hair restoration solutions, navigating hair loss, embracing life's journey, and everything in between. Welcome back to The Root. I'm Will Sadler, and I'm here with Lindsay, our trichologist. She was with us not too long ago with another episode about the frequently asked questions for female hair loss. So it was a lot of fun having you on that, and excited to have you here again, which is great.
I'm very excited to be back. It's always fun to talk about hair and how it can help.
So today we're going to kind of stem from that frequently asked questions episode, and we had kind of started talking a little bit about some things, but today is going to be more around the treatments, what we provide, what is out there, and specifically for women and that are going through hair loss. What are these treatments? How do they work? The benefits with them? Because there's a lot of stuff that's out there, and making sure that people understand the ins and the outs of different things, and proven solutions versus like what you always like to call the lotions and potions, right? That are
pills,
out there.
Potions, and lotions.
There it is. Yep. So we're going to do a little bit of a deep dive on that today, which is going to be great. So I guess touching back on just a little recap, we talked about the hair loss reasons, right? Yes. So with women, it's very different than, or can be very different than with men, because men typically tend to have more of a genetic pattern loss, which is, I guess, to some degree more predictable, I guess, right? Yeah. So, but with women, you can have more of a global thinning, right, due to hormonal fluctuations, menopause, postmenopause, postpartum. I mean, a lot of things. Honestly, from working here, a lot of respect for women nowadays, because my goodness, you guys go through a lot. So.
Yeah, we got a lot of different things going on. We got the autoimmune things. Yeah. We got sometimes thyroid, diabetes, and I mean, men obviously go through, those things as well too. But, then we got the hormonal fluctuations in there. We got the stress loss. Yeah. Women definitely go through a lot of different changes throughout our life, and there's a lot of different avenues to that.
Honestly, I can speak on that. My wife, God bless her soul, I mean, she is my rock, and she has definitely been going through a whirlwind of stress with the 2 pregnancies. And she, but she holds down the fort. I tell you what, she's great. So a lot of respect. But with that, stress and that respect and everything else, it comes with a price.
Exactly.
Sometimes the hair.
Exactly.
So let's kind of dive into this, because we look at a lot of different reasons for this hair loss, and it's not a one size fits all like we always talk about. Right. And having multiple different options is an important thing, and just because one option works for one person doesn't mean that that same option is going to work for that next person as well. So we have different proven options like FDA-approved laser hair therapy. Yes. We have PRP, which is platelet-rich plasma. There are some different regenerative type treatments that are kind of from biologics, if you will. And obviously the shampoos and conditioners, different things like that. That's your bread and butter there, Miss Trichologist.
Pills, potions, and lotions.
But it's some of these treatments can work as standalone. Some people need a little bit more, TLC, a little bit more tender love and care, and may potentially need a combination of things. But I think the most important thing is, everyone can benefit from what you really specialize in, and that's scalp health, and then we go into that. So before we get into the other treatments of like the PRP lasers, the regenerative stuff, talk to us a little bit about the shampoos, the conditioners that you specifically recommend, because it's very different than what you can get at like a CVS or like at a grocery store or what have you, right?
Exactly.
So talk through that a little bit. What makes those unique and different?
Not saying that all shampoos out there that are readily available to us are horrible. They're not, but a lot of times they kind of nix that scalp care side of things, and they more focus on the hair. How can we make the hair more manageable, more sleek, more, shiny, reduce the frizz, blah, 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 blah.
Because that frizz, the shininess, this, that, and the other, isn't that just the hair? It doesn't need more hydrated, or is it something else that's making it do that?
Well, actually, it could be a result of a couple things. I mean, a lot of us like to use hot tools. We color our hair. We do sometimes other chemical processes, stuff like that. But then also you got to take the type of hair you have into consideration. Just because you have fine hair, you could have fine curly hair, you could have coarse curly hair, you could have, naturally straight hair. There's so many different things, and not all conditioner is one size fits all either. Same with shampoo. And, that's kind of where Trichology comes into play. I'm helping whatever your scalp needs. Like, let's get to that basic level. Shampoo is what helps your scalp. It's very important that whatever's going on up there, that we can get that under control. And then, of course, the hair side of things. Then I'm looking at, what do you do to your hair? What type of hair do you have?
Right.
X, Y, and Z. And then also help that too.
That's a lot of stuff to consider.
Yes.
Man, oh man.
And
for me, I just kind of shampoo with the one that you told me to use, and I call it a day.
Yep.
So tell me, I guess, so oily scalp, dry scalp, again, products that you recommend for people. I mean, we take that Trichology approach of treating a scalp condition, right?
Yes.
So with the products like the CR Labs and stuff like that, what makes that different than like maybe like a Head and Shoulders, right? Head and Shoulders for dry scalp, for dandruff, this and the other, but we also have a line that's for dry scalp and dandruff. But what's different from Head and Shoulders to what we have?
Yeah, so Head and Shoulders, unfortunately, is kind of a one size fits most, right? But it's also not addressing all the different types of dandruff that are out there. There's actually a dry based or an oily base. Both come with itch, both come with redness, both come with flaking. So again, what do you know you're treating? Now, Head and Shoulders is more of the dry scalp nature, but a lot of times, just like some of the other products, it's like, hey, because we have dry dandruff, I'm going to use this one thing, but also if you have inflammation, it's the same thing. If you have this, it's the same thing. And with our products, it's more, okay, if we have a dry inflamed scalp, I would use something different than just a dry scalp. If I have a dry flaky scalp, there is a different product that I would use for that than just a dehydrated scalp.
Right.
And then, too, same with the oil side of things. There's greasy oil. So that's usually what we're commonly thought of. We're like, oh, I see a greasy appearance in my hair. I'm oily, right? But people can have oily buildup and never really see that come to the light of those hair strands there. So again, super important to get that, Trichology analysis, see what's going on up there. And again, create the best environment for that hair to grow out of.
For sure. So, and that's one of the things I was going to touch on too, because that's, I think, a thing that you do, and we provide this for all of our treatment clients as well, is where we do a Trichology test, testing out your oil levels, pH levels, hydration levels, getting data points on those, and understanding, all right, this is literally what your scalp is doing.
And this is literally what it looks like. And I don't just do just our normal microscopic analysis of looking at that hair. I actually dive in deeper. I do different camera zoom as well as a different light that shows me things that I can't even see at that naked eye level. So very important to go through that, because like I said, it's one of those common things of, oh, if my hair's dry, my scalp's dry, and that's not always the case.
Yeah, and that just gives just another layer there to just help out with treatments being as effective as possible too. So again, don't get me wrong, not everyone has to do these things to make treatments effective, but it's just another
piece to the puzzle. Absolutely.
So PRP, lasers, regenerative type treatments with laser hair therapy in women. Now, I know there's more of a time commitment to that because you come in 2 times a week, 30-minute sessions each time. Typically, you're looking at anywhere from 6 months to 12 months worth of time. Sometimes it can be shorter than that. Sometimes a little bit longer. It just kind of depends on the
loss,
the loss pattern itself. But the thing that I really do like about lasers, don't get me wrong, right, is that it's minimally invasive, or actually it's non-invasive.
Yeah, it's not invasive at all.
It's cold laser, doesn't hurt. It's FDA approved to stimulate hair growth from a genetic hair loss standpoint for both men and women.
Yes, absolutely.
But the thing that I like about it with regards to our female clients is that, like we talked about before, global thinning, right? Not just up here up on top, but also along the back and the sides. Lasers target everything.
Yes.
So with the lasers that we have in clinic, there are 5 panels, right?
Yeah, you're getting a 5-panel or a 4-panel approach. I apologize, 4-panel approach, but I'm hitting 360 on your hair. And that's very important, especially from the women's standpoint, because, not saying that the helmets and stuff out there aren't as great, but, we have that approval backing. So we know that this is a tried and true solution, but also too, I'm hitting every part of your head, not just the top, not just focusing on that, because we do have hair loss everywhere. So, and you know, it's not invasive. There's no pain with it whatsoever. It does require a little bit of more time commitment, but I mean,
Just becomes routine at some point.
it just becomes a routine at some point. And, you know, I love laser. It's always been a tried and true treatment. When I started working here 10 years ago, that's all we offered.
Well, and that's also what you
And that's
started
what I
off
first
with.
did for my hair loss. Yeah.
And that's, and honestly, I mean, we've been doing laser treatments for, I think, close to either 12 to 15 years or something like that, I believe. And it's obviously been a tried and true type treatment option. And
That's why we still offer it.
And it's been great, you know. So, I mean, looking at like laser treatments versus PRP, the way that I kind of works in my brain anyways, is like I like to try to think of like laser treatments as a repair, right?
Absolutely.
And then PRP, I almost think of it as like as a replace to some degree. And they're both kind of doing the same thing, but in a different way. Sometimes PRP can be a little bit more of an isolated treatment because they're injections that are done into the scalp versus laser taking that global kind of treatment. But lasers are helping with increasing vascularity or blood flow through increasing the diameter of the blood vessels. And lasers have been used in medicine for a very long time. I mean,
for years and years and years.
When I actually had 2 ACL reconstructions, I ended up using laser therapy on my patella tendon, like that kneecap tendon that hooks up to the shin, and so I had bad tendonitis. I used laser for that, and then helped out tremendously. So the concept with, you know, reduction of inflammation in the scalp, you know, the energy from the laser as well, because a lot of people are asking like, oh, that red light thing. I was like, no, it's not like a red LED light. It's laser, and with that, it's penetrating through the scalp, and it's the energy from the laser itself is absorbing into the cells to promote more energy that they're lacking, right?
Absolutely. I mean, I kind of, again, let's go back to the plant analogy, right? It's like the sun in the sky for your plant. You have to have energy in order to move through that hair cycle. And when we have hair loss, that energy breaks down. You're not getting, you know, all of what you need. Yes, can you survive at 50, 60% of what you need? Sure, but you're not going to do as well as you were if you had 80, 90, 100% of what you need, right? And so laser kind of, you know, gets things moving in that direction again, getting that blood flow, getting that nutrients to those follicles. And, you know, and it does help, you know, kind of repair at that cellular level, gets things stronger and healthier. And then you're regenerating better hair than you were before. And, you know, that is, I mean, hey, that's a great treatment alone to get your hair in the right place. And, you know, whether it takes 6 months, whether it takes up to a year, you know, there's different program lengths for different types of loss and what, you know, we encourage, of course. But, you know, laser can always be that really great base minimum treatment for clients, you know, to start that. But of course we have PRP too.
Yeah. So again, repair with lasers, like my analogy with it, I guess, is the way my brain processes it, because it's working with what's there. It's helping with the cells that are damaged to become stronger. It's increasing blood flow with what's there. PRP, you know, PRP is platelet-rich plasma. So, and the whole process with that, kind of talk us through that. What is, like, how does that, what do we do?
Yeah, so with a PRP treatment, ideally I'm using, as I like to call, your liquid gold to help promote that regrowth. And it literally looks like gold. So, you know, we have up to 5 times concentrated PRP, which is great because there is different ways of doing PRP out there, you know, different collection methods, different spin methods, stuff like that. You really, at the end of the day, want to get the richest supply of what you have, right? And we can do that. And what we do, simple blood draw, you know, we just take, you know, a little bit of blood. We spin it really, really fast for 10 minutes. And after that 10 minutes, that's what we extract is that liquid gold. And when injected back into the scalp, we're essentially promoting your own healthy growth factors to go in and help your hair.
Yeah, and for people that are a little bit, you know, nervous about needles, right? It's really not that bad of a treatment. I've had it done myself,
Me as well.
and We use a chiller device, which is actually great. It helps with kind of topically numbing the scalp a little bit, or just kind of chilling it some. And then we use a little vibrating tool to help with distracting the nerves.
Yes.
It's called the gate theory. So the nerves actually kind of focus more on the scalp,
Yes.
or on the vibration, versus the actual injection itself.
Right, exactly. And it makes it a pretty quick, and I wouldn't say painless, but pretty quick.
Most people
and
say it's like a 3 or 4 out of 10.
Exactly.
Right?
I mean,
So it's
as
not
I
too
tell
bad.
people, I live to tell the tale. It's very easy. It's not a lot of time that you're getting the injections done. We're looking at about like 5 to 7 minutes at most.
Yep.
And that chiller device is like one of my favorite
works
things,
great.
actually. It works fantastic.
Yeah.
And I loved having that ability of, after, because I did one of my treatments on kind of like my work break, actually. And it was nice to just be able to go back to work. Nobody knew I had it done. I didn't have any goops or anything that I had.
No topical kind of like anesthesia or anything.
Absolutely.
No lidocaine creams, no mess, if you will,
no mess.
which has been amazing for our female clients because before we had the chiller, we were using some of like that topical
Yes,
lidocaine
and
to
it
kind of
would-
help with numbing it. And then it was
Yeah.
like just a big mess
It
in the
would
hair.
get stuck in the hair, and
Yeah.
look, I'm not trying to cause more hair loss to get hair. Like,
Right.
we don't want to do that, right? So it was great. That chiller really has made a difference, and it just helps kind of distract you while things are going on.
Well, and the thing the reason why, like I was saying before, I kind of gravitate a little bit more towards PRP for myself anyways, because of, they're fast, they're easy.
Yes.
Same with laser. I mean, laser's, in and out 30 minutes. It's awesome, right? PRP, you just don't have to come in as frequently.
Right.
Typically, 4 to 6 weeks apart from each
About
treatment.
4 to 6 weeks apart, and
45
we usually
minutes
do
per treatment.
yeah, and we usually do a series of treatments. So that's the other thing too. I mean, you will still see us typically a few times, but it's 4 to 6 weeks apart. Sometimes people who live farther away, people who can't make that time commitment for laser,
Right.
we offer other things. And then, for those clients that want to do everything, you can hand in hand do laser and PRP together too.
Yeah.
So
No, I've seen really good outcomes with that as well. So, and kind of the primary concept around PRP and how it's working, right? It's those, you had mentioned growth factors.
Yes.
So those growth factors, from my understanding with it, helps with the healing process of our tissue.
Absolutely.
So like you've got your platelets, which is kind of the nuts and the bolts of PRP. That's why it's platelet rich, right? Plasma. So probably just to help with like people that are listening to this, to allow for this to understand a little bit more, right? Platelets, they help with clotting, they help
Yes.
with the scabs that form. So say you get a cut on your hand and that scab forms. As that scab starts to come off, you have skin still, right?
Yeah.
And it heals up, and that's due to the proteins called growth factors
Yes.
that are found within those platelets. So
Yes.
we're basically getting an enriched amount of those proteins that are then going back into the scalp to help with creating more blood vessels,
Yes.
to or repairing damaged ones in an area that need
Yes.
more vascularity, reduction of inflammation, but also kind of recruitment of stronger, healthier cells to
Yes.
replace out damaged ones. It does also help with promoting a little bit more to the damaged cells, but it kind of takes that extra step, I guess, if you will, with the recruitment.
Like you said, it's a little bit more of a replacement than like what laser is doing. I'm essentially repairing at that cellular level, and I'm improving how that hair, ideally is communicating with each other, and how your cells communicate, and it's using your own body's good stuff to do it. So
Now, with that in mind, though, not everyone's a candidate for laser. Not everyone's a candidate. Well, I guess laser is one thing, but
Yeah.
PRP is another one. Not everyone is a candidate for PRP.
Right. Not saying that, we can't treat with PRP in certain situations, but there really are some situations where people are on blood thinners all the time, or sometimes immunosuppressants, stuff like that, certain other medications that, ideally, it's not that, it's unsafe to treat with PRP, but it's also not always the best solution.
And that's where you have to look at, all right, we've got X, Y, and Z. This person, because with PRP, the treatment's only going to be as good as kind of what your body has to provide us, right?
Exactly,
Now,
exactly.
there have been, certain situations or anomalies, I guess, if you will, where it's like, all right, this person, we're good to do a treatment, but I don't know how good it's going to be because of the stuff you have to work with, and they do great.
Yes.
And same the other way around. But now we have this new biologics option
Yes.
that has been awesome. It kind of takes that guessing game out of it a little bit.
Yeah,
in
it
a
takes the
sense.
question marks out of
Yeah,
that.
so
you know.
beforehand, when someone that was going through different health things, whether it's like hypothyroidism or if it's PCOS or, a variety of different autoimmune or things that where the stuff that we would have to work with aren't necessarily the best. This option has been great because it's a biologics, it's a regenerative type treatment that that actually comes from a donor.
Absolutely.
And there's no blood draw. So people, if you hate blood draws, this is a great option. So,
awesome option. Or if you're a very difficult draw, also a very good option. Or hey, if you are concerned with how well your plasma can do for you, this is also a good option too.
And with this, one of the treatments that we have is actually just one treatment. It tends to show results for about a year and a half, 2 years, sometimes 3 years. It kind of depends. I actually just did a follow up with one of my clients that did one of the regenerative treatments about 3 years ago, actually, and she's still happy with how her hair is looking, which is great. And now, but with that regenerative treatment, although it does come from a donor, the product that we use, and it's our number one priority always for us as a clinic, is to make sure that we're giving the best product that we can for each and every one of our clients.
Absolutely.
So quality, reproducibility, safety is all extremely important. So the treatment is actually FDA cleared for homologous use, which is great. And so basically homologous, what that means is not for one specific thing, but it's safe for treatment. And I actually did the same treatment for my knee. So, but you guys are going to start thinking that this is going to turn into an orthopedic podcast. But yeah, no,
We're doing lots of things.
it really did help out my knee quite a bit, and it was done. I did a treatment there probably about, I think it was July of 2020. I had arthritis in my knee, still have arthritis, but the pain was reduced substantially, and the inflammation reduced substantially as well. So. It's been good for 3 years for me so far, which has been awesome. And I guess, 4 years now. Oh my goodness. But nevertheless, again, options that are out there, and these biologic solutions react or function very similarly to like PRP. It's just kind of an extra step up. It's got a higher growth factor concentration than what we can typically get from ourselves. And it's got some different messenger particulates in there as well that help with, again, that recruitment of our stronger, healthier cells that to come in and perform a role. So if people that are interested in this and they want to find out more, call us. I'd love more than anything to chat with you guys about it and go into a lot of detail. We're on limited time, obviously, today with that. But all these treatments are really pretty phenomenal options for a lot of different people.
Me being here for that 10-year period, I practice what I preach. I do treatments. I've done treatments and different treatments throughout my 10 years due to, different things with, the situations that I've gone through. When I first started at We Grow Hair Indie, it was kind of funny. I thought I was losing a little bit of hair. I looked at pictures back, when I was in my college days and stuff, and I was in my mid-20s by then, and I was like, wow, my hair has thinned a lot. And actually I had very oily dandruff as well too. So I jumped right in. I was like, hey, if these solutions are working for other people, why wouldn't it work for me? Who cares if I'm,
what do you feel like worked best for you whenever you did it?
Honestly, while I love all the treatments, I feel like if I did not necessarily start when I did, with my lasers, I feel like I was very consistently happy with my lasers. The only problem is that, later down the road, now I have 4 different kids I got to deal with, 4 different things. The time commitment, yes, I do work there, but when I'm working there, I'm there for you guys. I'm not there for my hair. So I have done some of the regenerative solutions here in the past couple years. And I will say, for where I am now in my life, age-wise and stuff, I think it was a great solution that I did, but not to knock what laser did back in the past either. But I feel like
great.
Thank you.
It looks fantastic.
It's one of those things that, when I treated with the regenerative things, it was being a little reactive to that shedding I was seeing based on my postpartum loss at the one point, surgery this last time and stuff like that. But, at the end of the day, it's helped my hair tremendously. It cut down that shedding got that improvement.
And with treatments, I know we've talked about kind of like what they're doing, how they work, so on. The more proactive we can be, the better, because treatments at the end of the day are going to be helping with the hair that is there currently. Once a follicle has miniaturized or shrunk in size to the point in which those cells are no longer there and they are now what we call basically inactive, treatments are not able to bring those back to life. So if you're worried, if you're considering that you're like, oh my gosh, I'm starting to be able to see more of my scalp, definitely look at addressing it sooner rather than later, because treatments, although have helped thousands of men and women, they still do have their limitations, and we want to make sure that we don't have restrictions, or try to give you the best opportunity that we can to get the outcome. And in the event, let's just say that if there is a lot of loss, and again thinking, man, I'm too late, right?
Too late.
There still are options outside of treatments, outside of transplants. There's non-surgical hair replacement, which is like a prosthetic. There are different avenues that we can help, and we can help you feel like you again, and give you back. So I think the biggest thing with all of that is, again, hope is not lost.
Hope is not lost. Come on in and see us, because, at the end of the day, one of those things are, if you don't come and see us, you don't know how we can help, and how, I know for a fact, over the 10 years I've been here, I've had people that have literally stopped doing things. I stopped going and seeing people. I'm worried about who might see me in the pool without all of these things. And they'll stop their life just because of the hair. And you shouldn't do that, and we have all solutions, whether it's the treatment side of things or whether it is non-surgical hair replacement. You can get your life back. You can enjoy your hair, and that can be one less thing for you to worry about, and it's just one of those things is the time aspect, better now than later. Let's not wait. Let's address it now, because, treatment is a little bit more time sensitive. But we do have that non-surgical hair replacement as well too.
So it's never too late. So
never too late.
Well, Lindsay, really appreciate you taking the time today, guys.
Thanks for having me again.
This episode flew by. My goodness. So
we could talk all day about treatment.
We literally do it for a living, and looking forward to chatting more. Thanks, guys. Email us at info@wegrowhairindy.com with your questions or topics you want us to cover. Head to our website to schedule your free consultation with one of our experts. I'm Will Sadler. Thank you for listening, and catch you next time.